All right, good morning. My name is Jeffrey Sargent, and this will be your first installation of the Occupational Circumstances Assessment Interview and Rating Scale, or OCAIRS for short. We will go through this PowerPoint, which will be a general overview of the actual assessment itself and the various forms that come with it, as well as the background information. And then in subsequent videos, you will also see an in-depth look at how to actually conduct the assessment and the various parts and methods to be able to make it successful. So first and foremost, one of the more important parts about understanding the OCAIRS assessment is the Model of Human Occupation, or MOHO. And so OCAIRS is going to be based on the MOHO itself and based on all the theoretical underpinnings that make MOHO what it is. So in order to really effectively utilize the OCAIRS assessment, you need to be well versed in what MOHO is, their definitions, and how they view human occupation. And I will say that several times throughout this presentation, as well as in the other videos that you will see as well. So this is very, very important. And I would highly recommend that you go back, and you can get free MOHO information all over the internet based on what it's all about, and make sure that you understand the definitions and what makes up everything. So we're just going to go through a few quotes real quick. So as Hagelin and Forsyth said, based on one of their studies that they conducted in 2013, they said that the OCAIRS, it takes a view of occupation as more than the use of performance components, for example, physical and mental ability, and embraces the complex interplay of clients' motivation, habitual routine, and the context for occupational participation. So think about that, and that's something that you could probably discuss for quite a bit of amount of time. And so the way that I actually see this is just reading back through it is more than the use of performance components, for example, physical and mental ability, and embraces the complex interplay. And so it's not just looking at remediation. It's not just looking at the various bits and pieces. It's looking at the whole picture of the person, what motivates them, and how they interact within the environment. And so you'll see that as you explore MOHO, with the theory that MOHO is based on dynamic systems, or dynamical systems theory, which you should have covered in clinical neuroscience. So just a brief slide with some abbreviations. You've already gone through OCAIRS and you know OT, but the ones down here, AMI, SMI, and SUDS. Just understand what those are. Those will be used intermittently throughout the presentation. So here is the OCAIRS assessment. This is the assessment manual. So with that being said, it comes with a pretty elaborate manual that really breaks down what this is all about and breaks down how to go about implementing this assessment. It's very important that if you were to use this, that you really go through the manual, study it, and understand everything that's going on. As you can see, a lot of these authors, if you look into anything MOHO in research, or mental health within research within occupational therapy, you'll see a lot of these authors pop up. So they're all over the place. So what is the OCAIRS? It was originally developed for use in the psychiatric care setting. So that you think one flew over the cuckoo's nest. You think an acute care inpatient setting, whether they're there for 3 days or months at a time. This is what it was used for, and this is who it was developed for, as a semi-structured interview with rating scale and summary form. So semi-structured interview, meaning that there is some guidance and there is some structure to it. However, it leaves a little bit of wiggle room for you to be able to work with the assessment and use what you know and use methods to be able to get the information that you need. So again, the rating scale is based on a 4-point Likert scale. You should have covered that in research and understand what a 4-point Likert scale is. And so the manual says it will take 20 to 30 minutes to administer the assessment. And I would say that after a lot of practice, you can get down to 20, 30 minutes to administer the assessment. But I would expect at least 60 minutes plus for the first few times that you do it. And something interesting with the OCAIRS is it doesn't have to be done in one sitting. So you can sit down, do 20 minutes or 15 or however long the amount of time that you have available, and conduct one portion of the assessment stop it, then later on in the week or later on in the day, you can come back to it and conduct another point. And that's all based on the setting and based on the people that you're interacting with. Some people might not be able to sit still for 10 minutes, 20 minutes, 30 minutes, 40 minutes. So, you just have to base that off your interaction with the client and base that off the setting. And so there's 3 different interview formats: mental health, forensic mental health, and physical disability. As you can see, right here you have the general definitions of what this is. So I will be talking in this video and the other videos more about the forensic mental health, because that's the experience that I have with this. And so forensic mental health is considered criminal justice with any mental illness, serious mental illness, and or substance use disorders, or with those combined being co-occurring disorders. But another interesting thing is that they do have an assessment within this for physical disability, which I actually like. So if you ever get the chance and you're interested in this, please take the time and look through it. It's very interesting. So this is, the OCAIRS is for older persons or the older population, adults and adolescents. So it has been tested and validated with adolescents, adults, and the older person community. And right now it's currently on version 4. So if you were to go through and research this a little bit and look into it, let's say you were to use Google Scholar and pull up the OCAIRS research pertaining to this, and you would pull up maybe some articles from 2014 or 2013-14, maybe some early in the 2000s, but a good majority of the ones will be late 80s and early 90s. And it will talk about the original name for this assessment, which was the Occupational Case Analysis Interview and Rating Scale. And that's what was initially developed as this assessment. And as you can see, we are on version 4, so a lot of things have changed, and they've made a lot of things based on research. So just going through what the OCAIRS actually is a little bit more in depth. So just some quotes from some research and from the manual itself. So it says it provides a structure for gathering, analyzing, and reporting data on the extent and nature of an individual's occupational participation. So it's very, very important to understand. It provides structure for gathering, analyzing, and reporting data on the extent and nature of an individual's occupational participation. Occupational participation. Think about what that means. As well, it yields fairly comprehensive information about the client's occupational life. That also is very, very important. And then moving down, it shows each category affects a person's occupational participation and performance. So within this, so when you're going through the OCAIRS assessment, which you'll see in a few minutes, you'll see that there's a section, and each section is labeled by these various factors and elements. So you have roles, habits, personal causation, values, interests, skills, short and long-term goals, interpretation of past experiences, physical environment, social environment, and readiness for change. And so each category, like it says down here, affects the person's occupational participation and performance. So let's say that the person has been active in substance use disorder for 10 years. They've gone through the gamut. They've been addicted to meth. They've been addicted to crack. They've been on heroin and fentanyl and all that stuff. So the past 10 years, all they've done is live their life for the drug, and everything that goes within that they've done just for the drug. So how is that role going to affect healthy occupational participation or performance? And what can we look at doing to be able to change that? And what are their habits? So like you'll see in some of the other videos that some of the habits were wake up, get high, go run the streets, do this, that, and the other, steal just to be able to provide for their drug habits. And then you'll see in other videos, one important area that I really, really appreciate from this is going to be interpretation of past experiences. And this looks at how they view themselves in the past, current, and future. And I think that's very, very important. As well, readiness for change. There's some key information in that as well. But this whole entire thing looks at how these roles, habits, personal causation affect their occupational performance, their values, their skills, their goals. Many of the people that we worked with in WestCare didn't have really any healthy short or long-term goals. They would say, my long-term goal is to be sober. Well, that's not a long-term goal. That's a task within a goal. If you were to look at a functional analysis, staying sober is something that leads to something else. So staying sober is a smaller portion of the bigger good or the larger good. So we're going to take a look at the rating scale itself. Very exciting. So the rating scale, 4-point Likert rating scale, or rating system as they say in the manual, and it's based off FAIR, F-A-I-R. As you can see down here, FAIR stands for facilitates, allows, inhibits, and restricts. And so based off what the manual says, it's how a factor impacts occupational participation. Thus, one can think of a person's skill level or environmental circumstances as either facilitating, allowing, interfering, or restricting the person's performance. So, if we were talking about roles and the person hasn't had a healthy role in a very, very long time, I would say that their current roles inhibit and or restrict engagement in healthy occupational performance or participation. And that can go, you can run through the entire system and do that. And you'll see more examples of that as we go through the other videos, as I will break down this further. But a key, and I'll be honest, in my experience with this, it took me a while to really wrap my head around the rating system itself. And so this is why I've included this here, is because it's important to realize in this quote, thus one can think of a person's skill level or environmental circumstances as either facilitating, allowing, interfering, or restricting the person's performance. And so you really need to understand what that means and how that works with the rating system down here. And it takes a little bit of practice to really get good at that part. And so here is the FAIR rating scale. As you can see, F-A-I-R, facilitate, allow, inhibit, restrict. You'll see more of this in the forms that we talk about later. So here are some criteria that have to do with the rating scale, and these can be used to guide your rating of the actual person. So if we're talking about roles, the person has very little satisfaction with current roles, major difficulty in fulfilling a wide range of role responsibilities. So they were marked as inhibit. And so it's important here too, and I'll go through this in other videos, is when looking at the FAIR system, you can notice on this slide or on this one, the rater is marked fulfills a wide range of role responsibilities as facilitates. But the person has issues with occupational roles reflecting a somewhat productive lifestyle, some satisfaction with current roles, and then inhibit marked one as major difficulty in fulfilling a wide range. So some of these may seem like they contradict, but that's all based on your clinical judgment and your interpretation of what's going on with them, and that person was marked as an allow. So you can see here that they have a marking in the criteria, an F for facilitates. They have 2 in allow or A, and they have 1 in inhibit. So you can do this. And then on the right, it says additional rater notes, or it will say comments, and that's where you justify what's going on. So some rating scale considerations. Making ratings is a professional judgment informed by the data gained from a good interview. And so a good interview is subjective. How do you know if it was a good interview? How long did it's not just based on time, it's based on the information extracted as well. Therapists should focus on making appropriate ratings of F, A, I, and R using the descriptor statements rather than spending a great deal of time selecting appropriate descriptor statements. So those criteria or descriptor statements are there to guide you in making a clinical judgment. That's what they're there for. It's not, oh, I checked this off, this means this. You really need to analyze what is happening with this person and the information that you're getting from them. And so it was important, and this is something that was pointed out in the manual and that they talked a lot about, and that in our classes at Gannon that you've heard a lot, I'm sure that you've heard a lot from various professors, is the impact or the functional impact of culture and context. And why is this important? So going to the manual for OCAIRS, it says that a therapist should avoid imposing his or her individual cultural views throughout the interview. The therapist should be aware of his or her own cultural background to avoid imposing criteria from his or her cultural perspective upon an individual with another perspective. So what does that say in a nutshell? And you could really break that down and have a really robust discussion about what that means. Is that yes, you're there conducting an assessment, and yes, you're there trying to get information that will inform clinical judgments and they'll inform goal planning and so on and so forth. but you're not there to be ethnocentristic. You're not there to impose what you feel is normative or right on someone else who has grown up in a completely different lifestyle, a completely different culture or context than you have. And so that's where inclusion comes in, and that's where really getting down to the level of the person that you're working with and breaking it all down. And that's why this assessment is so effective, is that you can really look at all these different aspects of a person's life and engage, or which will help guide your clinical judgment with it. So consider the functional impact of culture and context. I think that's very, very important and something that needs to be realized when you start using this assessment or any assessment. And that goes into anything, whether you're in acute care, outpatient, inpatient, it does not matter. Culture and context are important for the situation. So some prerequisites to the administration. Again, you'll see right here in blue, understand what MOHO is. And I'll say this on top of understanding what MOHO is you have to understand the OTPF. You have to understand what occupational therapy is and what occupational therapy's goal is, and understand what's going on. If you don't understand occupational therapy, the OTPF, and you don't understand MOHO, then you'll have a hard time administering this assessment because you really won't understand what's going on and the information that you're trying to get. So you need to prepare for this. You need to look at the OTPF, understand roles, values, beliefs, culture, context, all those different variables that are within the OTPF, and then understand how they are applied within MOHO and the lens that MOHO provides as a model of practice or a practice model. So, prerequisites. The practitioner, again, must understand the theoretical background of MOHO to be able to effectively use and administer this assessment. One more time, the OCAIRS is based on the MOHO. So I have provided my own opinion here below. And so my thinking on models of practice theory and frames of references. So we go through this, and I think one of the best books that you read during your summer semester was called Conceptual Foundations of Occupational Therapy Practice. And that was by Gary Kielhofner, who was the founder of the Model of Human Occupation. And so I'm actually doing my DSI on my capstone right now, and I pulled this book out because the information in this book is so important, and he provides a really good breakdown of what models of practice are and what it means. And so to understand what MOHO and to understand how to really use it, you have to understand what a model of practice. And one thing that I took from that book is that the model of practice provides a lens for you to look through while applying the general theory of occupational therapy. So you have the general theory of occupational therapy, and you have the general language, the common language seen in the OTPF. And now you need something to use to be able to apply those, but through a specific lens based on what you are more comfortable doing. And so let's say you choose MOHO, and because you choose MOHO, you're really interested in the dynamical theories or dynamical systems concept. And so you're really interested in the input, the throughput, and the output, meaning the input, your interaction with the environment, the throughput, or the process, which is where MOHO really is in the throughput stage. If my cursor will come up, it's right here. So when you're starting to think about throughput, you're starting to look at a person interacting with their environment. Why are they doing it? And what's motivated them to do it? What sort of habituation patterns or routines have they developed, and what is the reasoning for this? What sort of skills and occupational participation? And you're looking at personnel causation and all these factors that have to do with the throughput or the processing portion of their interaction with the environment. And then you look at their output. The output is after the decision's been made or after the process has been completed, and that leads to the action, I guess you could say. So again, moving down into volition, which is motivation. And volition can come in many different areas. Volition can come from values, performance capacity, all these sorts of things that have to do, is it internal or is it external, or is it intrinsic or extrinsic? Is it intrinsic volition, meaning is it motivation from within, or is it motivation from the outside world or environmentally? And so you break down all this stuff. So you're like, all right, well, I want to look at the person's motivation, and I want to look at, what type of patterns and routines are they starting to form based on their interests and based off their motivation, and have they developed the skills to be able to partake in this? And what, if they have developed skills, does their participation or performance look like? And so to break this just a little bit further down, so how would you apply the model when using volition and habituation as core elements of your lens of practice? If you are a MOHO-based practitioner, these elements will be the core of your practice. So these are things that are going to be very, very important to you. And so just another thing going from that book that you read over the summer that Kielhofner describes what a model of practice or a practice model is based on the theory and is based off the lens, but it's also based on practical resources or practice resources that are available. And so when thinking about that as you go through, you think theory, okay, well, we have this theory, but now we have this model of practice. Well, the model of practice has practice resources, meaning, and you're looking at it right now, is the OCAIRS. So MOHO has OCAIRS, it has MOHOST, it has all sorts of resources that you can use based on this. So hopefully this has not confused you more, but just it's interesting to think about and something to keep in the back of your mind when going through this. So I took this, as you can see from the manual, and I think it provides a great overview of what OCAIRS is using a theoretical material to understand the client situation, which we just talked about. The interviewer must integrate considerable knowledge, skills, and experience during the interview. In terms of knowledge, the interviewer needs to be clear about all of these things listed here. So when you're entering the interview, what's the purpose of the interview? What are you trying to get? What are you trying to do? And the content of the assessment and the information needed to make the ratings. What do you need to extract? And so that's where this whole taking 60 plus minutes to be able to conduct the interview comes out. As a practitioner, as a person, as the administrator of the interview, you need to figure out a way to use this interview to get the information you need to make a clinical judgment or to make a rating on the current person at hand. And so the theoretical material upon which inferences are based, and you're looking at the MOHO right there, and you're looking at volition, habituation, so on and so forth, and the compatibility of OCAIRS with the treatment plan. And so if you're going to be developing a treatment plan, you should be able to look at the OCAIRS and be able to develop a treatment plan based on what was talked about and based on what was extracted from the person. So moving down, you have the interview needs skills for communicating effectively. And I know I was talking with Dr. Castelli. I know that you guys have gone through motivational interviewing, and that's really, really important. So I have a couple of friends that are OTs. One specifically that's a mental health OT for the VA system at James Haley in Tampa. And we were just talking recently about the importance of motivational interviewing and saying that that's a huge thing right now and that you need to become as proficient in that as possible because it's used quite a bit in the field. And so communicating effectively, reading nonverbal behavior and interpreting meaning, that is extremely, extremely important. You need to be able to assess the situation and not just take it at face value for the words that are being said. You have to look at the overall behavior of the person and try and interpret what they're meaning. And based off what they're saying is being able to ask other questions to be able to get the information that you need. Beginning and ending the interview gracefully. Learn how to start the interview and end it. Learn how to keep it flowing and keep the interviewee focused on the interview content. You'll see people start to fade in and out and go on their own little tangent. So you need to be able to keep it focused on what needs to be done. And so staying within the time limit established. This is why you need to practice. If you're not going to get a lot of time, you may have 30 minutes that you have to be able to conduct this assessment. So you need to be able to conduct and finish this assessment in 30 minutes. And the assessment itself. So we're going to go over some areas of the assessment, some forms, and so on. So again, here, a brief rundown. These are just images of what the assessment actually looks like if you were to take it out of the assessment manual and use the paper forms themselves. And so this is the OCAIRS Forensic Mental Health Interview Form 2. There are 4 forms within each category. Remember, mental health, or forensic mental health and physical disability. So we will go through these in great detail in later videos. I just wanted to show you what it looks like. So again, you have all these factors or elements: roles, habits, personal causation, values, interests, skills, so on and so forth. And you have the fair rating scale and then the final notes. And so the criterion, the element, And I look at these as the justification. It says final notes, but I justify my rating based off what I write here. And just going through the goals, long-term interpretation of past experiences. One important thing here that I'll talk about a lot is when you think about life so far, do you think that you've had a good deal or a bad deal? And this is one of the questions that I like to focus on a lot when going through this, because it helps you guide and helps you get a really good understanding of the person that you're working with. Physical environment, social environment, and readiness for change. All right, then this is form 3. So here, again, form 3 of 4 forms for the forensic mental health interview. Here it's just broken down a little bit. It's a little bit more condensed. You don't have the rater comments. You can go through, check these things off based off what's happening, and then justify them later or whatever you're more comfortable using. I like written notes first so I can write down. I like the kinesthetic learning approach there, because as you're taking in this information and writing it down, it's reinforcing your understanding of the person, in my opinion. So, and this is going to be the OCAIRS data summary form 1. And here you can see it's just broken down here. You have all the factors, criteria, the rating scale, and the comments. And so if you don't need question formats or interview formats and you're good, then boom, knock this out and here you go. And so then here's OCAIRS data summary form 2. I like this one a lot. I think this is a really good end of the packet / end of the section of a packet that shows the OCAIRS summary. And so you have all the information here based on the rating scale. And then you have the need for occupational therapy. This, I think, is very, very important. And then, again, go within your SOAP notes and so on and so forth. You should be advocating, if the person needs advocating, to be able to advocate for occupational therapy. And this is how you justify it. This is where you do it right there. All right. So here is the OCAIRS forensic mental health interview, and this is form 1. So a little backwards, but I just wanted to go through the forms first, then get to the semi-structured interview portion of it. So here you have roles, habits, and all the elements or factors that go within the OCAIRS, and you have questions. And so I use this, and so even now I would still bring this to every single interview that I would conduct, is because I think it's important to have a baseline to go off, especially in the beginning. So roles. The intent with this is to provide you with information and questions to guide the interview. And I think it's very important. So do you have any family responsibility? Are you managing to keep up with these? What else do you do? What other roles do you fill? So on and so forth. And so this is where the semi-structured portion of it comes in. It's not a standardized structured interview that you have to ask this question, this question, this question, if then else, so on and so forth. You have the freedom to be able to use questions from here or use your own questions to be able to get the information that you need to make a clinical judgment. And so, like going down here in personal causation, again, if you don't understand MOHO, will you understand what personal causation means based on what MOHO sees it as? I don't think that you will. So you need to make sure that you understand MOHO. How well do you think you understand your own abilities? What things do you feel you do well or are proud of? Versus, what are the most difficult things for you at the moment? And so on and so forth. You'll see in personal causation the differences between a person answering what they do well and what they don't do well. And as you go through, there's all sorts of questions, and this is included within the manual. And again, I would bring this to every single assessment. And if you ever get stuck on anything, even if you've been doing it for 10 years, it's important to have a good baseline, I think. All right, so this is form 4. So forensic mental health form 4 keywords. I brought this and will still continue to bring this to every single time or every single assessment that I would or will conduct. And so this provides key words that you can use to help guide your questions. Key things within each of these factors are elements, roles, and these are examples of roles, so on and so forth, habits, routines, patterns, weekday, so on. And so as you can see as we go through this, excuse me, and so motor skills, process skills, communication, interaction, physical, mental, social, emotional. You can base your questions based on these and look at each one of these terms or phrases here if you don't have the actual interview questions with you. I like this because you'll get to a point in an interview where you might have a space of like some silence where you're like, I gotta try and figure out what I gotta ask next. Okay, let's see. And then you can pull this form out and be like, boom, interpretation of past experiences. balance. I know what balance means. I know what occupational balance means. Therefore, I can ask a question of how in the past they've helped or how they've balanced their life. So I think it's very important. It's another tool for the tool belt. All right, after a little break there and a little mishap with my presentation, we are back. So following all of that information, we are going to move on. Again, that was general. You will have several other videos that I have made to help break down and understand the assessment a bit more, and those should be posted with this video as well. So here we have online MOHO software, and so during my search for this assessment and during my work with this assessment, I found this, and I think that this is extremely helpful. And again, I will actually have a walkthrough of how to use the MOHO software or the MOHO website itself to be able to conduct assessments, and track clients or patients. So here, this is just, a screenshot of the MOHO website and what it looks like. So if you were to find it, or if you were to look up the MOHO website, you'll find this. And I consider it a one-stop shop for all things MOHO. And it includes all the assessments, scholarship, and resources and networking opportunities. So you can go through and you can purchase assessments or get free assessments that are within here. You can look at the research that's available or has been conducted concerning these assessments, which is really, really cool. But there's also resources and networking for other people who consider themselves MOHO practitioners. Also, what I just found the other day when I was looking through this is if you were to go to products, you can actually pay $300 for every single MOHO assessment that's available, and it can be added to your little portfolio of assessments. Other than that, most products are $40 or $44 a piece, and that comes with the assessment, and it also comes with the assessment manual. And if I'm not mistaken, once you have the assessment manual, you can print the assessment forms at your leisure, meaning you don't have to purchase new assessment forms, which is a very good aspect of this. If you've looked at other assessments where you can buy bundles of 25 assessment forms, which is ridiculous. But, people got to make money, so that's cool. Anyways, so moving on, you have My MOHO, which is up here. And again, I will go through this in more detail later on. So going to My MOHO is a centralized place for your purchase and downloads. As you can see here, I've purchased these way back when, and I've purchased these or added them to my site. And so I have OCAIRS right here, OFI, which is the occupational, I think it's, don't quote me on that, personal or performance history 2, ACES, which has to do with communication style, and MOHOS, which is similar to OCAIRS but a little bit different. And so again, note what would you like to do, and you go over here. You have these options for find a new assessment, create a new evaluation, find an existing client's record, or run a report. So here I have the information. You can conduct evaluations from here or here, and you have the continuity of documentation. So you can find a client's record or run a report. And these are very, very important once you start, getting a lot of entries in and you have a caseload of, let's go, 6 to 10 people that you see daily, and you need to run a report on progress, run a report on goals being met, so on and so forth. So this is, I think, great resource to be able to use, and there's a way to be able to make it HIPAA compliant if you're in a situation where you're not, where the resources are less than wanted, or all right. And that, so here we just have another slide of what we're looking at. So let's say you were to choose OCAIRS, you can come in here and work with this and get started with a forensic mental health assessment. And there's that. So I will go into this in much more detail in other videos, and we'll do a walkthrough and I'll show you exactly how to go and use this. All right, so excuse the technical difficulties here. I'm going to try and piece these videos together. So again, my name is Jeffrey Sargent. I'm a third-year student, and this has been an Occupational Circumstances Assessment Interview and Rating Scale, or OCAIRS presentation. Again, this is the first of, I think, 2 or 3 videos that will be on the OCAIRS. The other videos will really break this assessment down into more detail, as well as what the assessment looks like when conducting it with someone, and how to utilize the MOHO system online or within their little MOHO website. I hope that you've learned something from this, and I know that, this may learning assessments is kind of hard because you get all this information about something and you're like, okay, well, what am I supposed to do with this? Okay, so I can pick this up and go do it. Well, it takes time and it takes some practice, and it takes, you got to research it and you got to look into it, read the manual, read the information about it, and become really comfortable with the terms and definitions so you can use them while conducting the assessment and use them to understand the assessment further. So I hope that you've enjoyed it. I hope that you've learned something, and be on the lookout for the other videos. Thanks.